I'm sitting in our new hyperbaric oxygen chamber, and I can't tell you how excited I am to have this chamber. For the past 20 years, I've been planning or wanting to have this toy, and I have not been able to, only because older chambers were not absolutely suitable for the type of surgeries I do. Meaning that in the old days, the chambers were rather cylindrical and the patient had to lay flat within them. Nowadays, this chamber is very much bigger, as you can appreciate. This is the control panel. I have a TV here that I can watch my favorite shows on. There is an AC behind me, and there is a chair for another patient or another individual within this larger chamber. So this is a nice, comfortable chamber. I'm sitting on a lazy boy reclining chair, very comfortable, and this is exactly what would be best for my type of patients who have had body work, patients who have had tummy tuck or body lift, and they need to be in more of a sitting position rather than laying flat immediately after surgery. So when this chamber became available, I jumped on it and I bought it, and I am excited to be in it even myself. I have actually been in it on Monday, Wednesday, and today, and I plan to continue to be in the chamber twice a week, 60 minutes each time at 2 atmospheric pressure. That means that the pressure within the chamber is 2 atmospheric pressure at 95% oxygen. More of the oxygen dissolves in your blood, and therefore the oxygen is carried within your body, and it has obviously therapeutic and prophylactic benefits. The therapeutic effect of a chamber have been known for many years. For about 40 years, there is a ton of research on medical chambers, their benefit, obviously help with healing and infection and so forth. When I was doing my residency in Pittsburgh, whenever we had really bad traumas or reconstructive surgeries, or we wanted to salvage a flap or a piece of tissue, the hyperbaric oxygen chamber was our go-to device or modality to help us to get the patient through that hard reconstructive procedure. Also, whenever we had really bad infections or infections within the bone, the patients were transferred into a hyperbaric chamber for about 10 to 15 treatments or treatments every day to help with the infection, in addition to IV antibiotics. Since then, we've come a long way. Today, we understand that these chambers not only help you with healing, not only help you with infection, but also have anti-cancer benefits, anti-aging benefits, anti-inflammatory benefits. So there are a ton of benefits to having a chamber or to having sessions within a chamber. Most of the anti-aging benefit has been shown through a study that was done in Israel, whereby they showed that 2 months of hyperbaric oxygen therapy twice a week can actually help DNA repair by 30% in senior citizens. Recently, I actually had a test known as True Diagnostic, whereby it looks at your DNA profile and the damage that has been caused to your DNA through aging, through sun worshipping, and so forth. And since I've had the study, and since I have the chamber, now I'm doing a study whereby I plan to be in the chamber twice a week, and then do another study on my DNA in about 6 months and 1 year to see for myself the anti-aging effect of this chamber and the repair that the studies have shown to my own DNA. Through my own lab work, my DNA studies, I've even sequenced my DNA. We can see what happens to me, and maybe you guys can benefit from this.